Friends, diabetes is a common disease. We call nowadays India as a diabetic capital of the world because more than 80 lakh to maybe few crore people may be there of diabetic diagnosis in our country, and diabetes is growing up by leaps and bounds. So remember, diabetes has to be controlled, because if you do not control diabetes, diabetes will lead to heart disease, it will lead to nerve damage, it will lead to kidney damage, it will lead to eye damage. So diabetes must be controlled. So people ask me, doctor, what kind of food should we eat for diabetes? Now there is a list and lot of contradictions happen. So whether you should take fruits, whether you should not take. Now let me tell you how this diabetic food has to be decided. What kind of food you should eat? Very simple thing. Remember, in diabetes, what is deficiency is insulin. Now what is the function of insulin? Insulin allows the blood glucose to enter the cells. So if the insulin is not there, blood glucose will go up in the blood and it cannot enter the cell. Suppose the insulin is less, then what will happen? It will take longer time for the glucose to enter the cells. So the blood level of glucose will go up. And this is what is diabetes. That means the glucose is entering the cells. When we eat glucose, when we eat carbohydrates, they go to the gut, and from the gut they get absorbed in the blood, and the blood sugar, blood glucose level goes up. Now it will reduce by entering the cells. But if the insulin is less, so that introduction of the glucose will be less. And if the glucose is not going inside the cell, then it will be there in the blood. So what you have to do? You have to slow down the glucose uptake of the gut. Now what kind of food do you have to go for it? Remember, there are two kinds of carbohydrate. One is called simple carbohydrate, one is called complex carbohydrate. Simple carbohydrate is one which breaks up very fast and goes to the blood at a time. Complex carbohydrates are not easy to break, so it takes longer time. So it is called slow carbohydrate. So what you have to do for diabetes, you have to eat slow carbohydrate, not the fast carbohydrates or simple carbohydrate. Now how do you distinguish? It's a very simple method, I'll tell you. You put any food in the tongue. Remember, in the tongue, if the simple carbohydrate reaches, immediately releases glucose, and it will touch the tongue and the tongue will say it is sweet. If it is complex carbohydrate, it will release glucose very slowly and the tongue will not get any sweetness. So any food that you eat, if it is sweet to taste, remember it is not to be taken by the diabetic patients. So very simple formula. Our tongue is the best machine to check whether it is complex or simple. So you add any food. If it is sweet, please avoid it. If it is not sweet, carbohydrate but not sweet, then you can take it. So remember, fruits also you can distinguish. Those fruits which are very sweet, like banana, like chiku, the sapota, or grapes, sweet grapes, or mangoes. These are items which are very sweet. So, and you should avoid them. If the papaya is very sweet, avoid them. If the papaya is not so sweet, take them. So remember, our tongue is the best machine to know what food to eat and what not to eat. So please follow this dictum. Very simple. Don't go for long list, sir, allowed or not allowed. Only believe in your tongue. If the tongue says it is sweet, then don't take it. If the tongue says it is not sweet, you can take it. And that's the best way to find out food for the diabetes. Thank you so much. You are listening to Dr. Bimal Chhajer. As I told you, we have lot of knowledge for the heart patients, for the diabetic patient, how to reduce the risk of heart attack. And for that, we have opened a NGO called Punyya Life Foundation. The aim is to educate the whole of the country to reverse heart disease, also to prevent heart disease by controlling sugar, cholesterol, triglyceride, obesity, blood pressure, and all the lifestyle factors which lead to heart disease. So I'll take off from right now. Bye-bye. And you must forward this video to other people so that they can understand the simple formula about diabetic diet. Thank you so much.